Welcome. My name is Peter Strong and I'm a professional psychotherapist, and I offer therapy by Skype for help with anxiety and depression, and also for help with recovery from addiction and other psychological emotional problems that don't require medical treatment. So many people like therapy by Skype as an alternative to going to see a therapist in their office for clinical evaluation and treatment. Many people just really don't need clinical treatment. What they're looking for is simply more effective ways of working with anxiety and depression, the two primary forms of emotional suffering that most people struggle with. So there are many reasons why people like online therapy, but if you're interested in doing online therapy, do make sure that you select a therapist who uses Skype. It's really important that you have Skype so you can see each other. If you can see each other, then there's no difference between therapy by Skype when compared to therapy in person. Being able to see each other is the key factor here, and it is necessary to allow effective communication. People like Skype therapy because it's more comfortable, it's less intimidating, there's greater anonymity with Skype therapy, and that's often an important factor. People often want to work on their emotions in a more private setting than may be available if you were to consider going to see a therapist in an office. Many people don't have access to a local therapist, or that they choose not to see therapists in their local area. Many people come to me because they are stationed abroad and don't have access to the right kind of therapist where they're living. I also work a lot with people who are homebound for one reason or another. Clearly, I work a lot with agoraphobia, because if you suffer from agoraphobia, it's almost impossible to leave home. I also work a lot with people who suffer from driving anxiety. Again, the driving phobia makes it very difficult to drive to a therapist's office. I also work with young mothers with children to look after, or even business executives who don't have the time to go and commute to a therapist's office. So it's about convenience as much as anything. But also, people come to me specifically because they have an interest in mindfulness therapy, which is what I specialize in. And I have developed a system of psychotherapy called mindfulness therapy, or mindfulness meditation therapy, that has proven to be incredibly effective for working with anxiety and depression. So if you'd like to schedule Skype therapy sessions with me, then simply go to the contact page and learn more about how to set up a Skype therapy session, and then email me. Tell me about your particular needs, and I'll be happy to answer any questions you have, and we can schedule a Skype therapy session. So, mindfulness therapy really focuses on helping you change the underlying reactive patterns that feed your anxiety or depression. So particularly we work on identifying and changing reactive thought patterns because that's one of the main ingredients that feeds anxiety and depression. Thoughts don't cause anxiety or depression, but reactive thinking will feed it if it's already there. So working with reactive thoughts is really important. We learn to see these reactive thoughts clearly by meditating on our emotions, our anxiety or our depression, so that we can see these unseen reactive habitual thought patterns more clearly. A golden rule in mindfulness therapy is the more you see, the freer you become. So really seeing those reactive thoughts is important. And then moving to a position where you train yourself to stay as the observer, seeing the thoughts, but not becoming blindly identified with them. Thoughts themselves are not the issue. Even negative thoughts or painful thoughts, they are not the problem. The real problem is the identification, the blind attachment to those thoughts. That's what then gives them power over you, and also that results in feeding the underlying anxiety or depression. We also work a great deal on developing a very strong mindful relationship with your emotional pain. So usually at the core of all anxiety and depression, you'll find emotional pain. It's like a wound that hasn't healed properly. We really need to build a compassionate, conscious relationship with that part of ourselves that is afraid, or that is hurt, that's in pain. The stronger that relationship between your true self and the emotional pain, the faster it heals. That's a very important feature of mindfulness therapy. And the way we build that relationship is by meditating on our emotions. Talking about them doesn't necessarily build that internal relationship anywhere near as effectively as sitting with those emotions with an open, compassionate, conscious mind. So those are just two features of mindfulness therapy. There's lots more to learn, and I will teach you exactly how to work with your anxiety or depression or addiction using mindfulness during these Skype therapy sessions. So if you're interested in scheduling therapy by Skype for your anxiety or depression, then do please contact me, tell me more about yourself and what you've tried so far, and then we can schedule a Skype therapy session at a time that works for you. I see people worldwide. Most of my clients live in North America, but I also see quite a few clients in the United Kingdom and often as far away as Australia. So please contact me if you're interested in learning more about online psychotherapy by Skype. Thank you.